If you're hoping for an overseas getaway, you'll need to pay for COVID tests. But customers who've suffered poor service and delays question whether the system can cope. Now, a worker from one of the private testing firms has spoken anonymously about what happened to some people. How would you describe what was going on behind the scenes?
They're not getting value for money. They're not getting their test kits on time. They're not getting their results in time.
That test company, Anglia DNA Services, told us delays and errors affected fewer than 1%. They've apologised, given refunds and say they resolved problems quickly. On some customers, there was a big impact.
There's a danger of people overextending their quarantine, unable to go to work commitments, or even children missing exams.
Tajinder Sahota was a customer of the same firm in April. When he returned from his wedding in Canada, the test result he needed to leave quarantine came late. Living with elderly parents, he was anxious.
Inconvenient and very frustrating. You do end up having to put things on hold. I was living in a sort of slightly separate part of the house. I was wearing a mask indoors. I was doing all those things to protect the family and not going out and arranging anything outside of the house.
The company refunded, apologised and says it used special couriers at its own cost to help customers affected by a small number of problems which were beyond its control. It says such issues are not representative of its service. Whether your destination is categorised as green, amber or red, you'll need to buy COVID tests for your return to the UK. The number needed varies. Known as PCR tests, these involve a swab of the throat and nose. They can either be done at a test centre or taken at home, then posted for analysis. PCR tests range from £27 to almost £400 each. We've learned there have been more than £1 million in refunds across the sector. The head of another test firm that had problems delivering results insists those issues have been fixed, but suggests more scrutiny of firms on the government's approved list.
I think that better policing of the list would help. Unfortunately, there's a resource cost to that, and in effect, the only thing that they could really do is sort of somehow mystery shop every one of these firms.
The Department of Health told us it does monitor and evaluate these firms, removing any that fail to meet minimum standards from its approved lists. But with the peak holiday season ahead, test firms may yet face their biggest challenge. Chris Choi, ITV News.